Hi, this is Jeanie Shea, your Hoover Realtor, and today we are at MedWest, the freestanding emergency department in the heart of Hoover. I'm sure all of you guys have seen it, located right behind the Sprouts and Starbucks off of 150. And I'm so excited today to get to speak with Dr. Carson Penkava, who's one of the emergency medicine doctors here. So thank you so much, Dr. Penkava.
You're welcome.
So I have a few questions for you.
Sure.
So one of the things that I hear around the community is people are kind of confused. Who comes to a facility like MedWest, emergency department versus going to one of the, I hate to call it a doc in a box, but one of the other facilities where you would go for a cold or flu? What's the difference in the two?
Sure. So we can handle almost any type of emergency department patient here at our freestanding ER. Kind of the difference from a hospital is that we don't have other physicians on site, so I don't have consultations immediately available to me, but rarely do I actually need those when I'm working at our main campus either. So we can see pretty much any type of emergency patient: chest pain, stroke patients, abdominal pain, any kind of injuries. We're not a level 1 trauma center, but most places in town aren't. So major traumas, maybe obvious heart attacks are going to go straight to a facility that would manage those things. But we can take pretty much anything else. And then the main difference, I would say, between an urgent care facility and what we do is that we're going to focus more on the life-threatening emergency situations. We see anybody, we can take anybody just like any other emergency department. So we do manage coughs, colds, other kind of less life-threatening type presentations. But what sets us apart is kind of the training of our physicians and the capabilities that we have. We have trauma rooms and kind of CT scans that aren't available in urgent cares as well.
So another question I have for you, I'm curious to know, how many patients do you see regularly? What's a busy day like for you?
Sure. We're actually a busy emergency department. We see almost as many patients as anywhere else in town. Average patient volumes per day is probably 80 to 120 patients.
Wow.
Last week we saw over 160 patients. So we can see quite a few patients in a given day, but despite having a large amount of patients, we actually, our throughput's pretty impressive. Most people are seen within 5 to 10 minutes of arrival, and in a room within 5 to 10 minutes of arrival. Now sometimes when we get 15 people check in at once, that's not going to happen, but for the most part people are in quickly and they get out quickly. Even with a CT scan, most people are in and out in less than 2 hours.
So I have a random question for you.
Sure.
So I always wonder, how do you, being a physician, work with all these sick patients and germs, and right now it's flu season.
Sure.
How are you standing here and you don't have the flu? How does that work? I want to know your secret.
I wish there were an easy question or answer to that question. There's no definite way to prevent us from getting the flu. One of my colleagues had the flu last week. But we try to avoid any getting contaminated. We wear gloves. We have patients wear masks a lot of times too. When we think they have the flu, we'll ask them to put on a mask to help prevent coughs from entering the kind of the air and from us inhaling those kind of droplets and things of that nature that can pass on the flu.
Man, I was hoping you were going to tell me the silver bullet.
No, we all get sick.
Oh, wow.
So,
Okay.
yeah.
Well, thank you so much.
Sure.
I so appreciate you all being here. And I think as Hoover residents, we're just so grateful to have a facility like this in our back door. So I want to thank you guys for everything you do.
Sure.
And anyone who has an emergent situation, come on down. This is a great place to be. So this is Jeanie Shea, and thank you so much for joining us for this episode of Meet Your Hoover Neighbor.